Very good. Welcome to the 907th meeting of the Board of Directors of MSAD27. Roll call, please.
Keith Drondro.
Here.
Isabel Lozier.
Here.
Happy Pooler.
Here.
Toby Drondro. Leroy McKenzie.
Here.
Gary Sibley.
Here.
Sarah Ashley.
Here.
Very good. First order of business, public participation. We'll get one person signed up. You get 10 minutes.
It's only gonna take a couple minutes, but had a long, hard road here together. Working against each other, working with each other, working for each other. I really hope that after our meeting today, we have adopted the CDC recommendations to go optional masking. Put this behind us. Not forget about it, because we can learn from history, right? And our town is back open to full business. So please take that recommendation. Thank you.
Okay. Item 3 under Superintendent A, COVID-19 transition plan.
I know I've shared this with the board, so I'm going to try to go over it as quickly as possible. But I think in addition to adopting CDC guidance, which we have the entire process, we've adhered to the guidance. I think we could even take it a step further. So my proposal here not only has the new recommendations, but it also has some additional measures that I think we can take in order to try to return a little bit more to normal than we have been for the past 2 years. So without further ado, first of all, on March 2, the DHHS Mills administration did make that announcement that effective March 9, universal masking is no longer a recommendation. We should be moving to optional masking, part of this guidance. So what does this include? It does include that optional masking piece where everyone is allowed to choose what they want with regards to masking. There are a few caveats though that we'll discuss a little bit later. I will also add that I think we should also include the following consideration, which is school outbreak. If we do reach a school outbreak, which is defined as 50% or more of the students are out for COVID-related reasons, we should have a period of 5 days of universal masking just to try to mitigate how many students and staff we have going out. And after a 5-day increment, we look to see if we're now below that 15% threshold and go back to optional masking. So that would be the only time that we're recommending some universal masking is if we do have an outbreak. And that's not for the district, it's just by school. So if there's an outbreak at this school, that does not impact Fort Kent Elementary, so on and so forth. We're going to have to make sure that we are taking care of those staff and students who want to continue to wear masks. There will be that population. For staff, we will have some KN95 masks available. This is just a little bit higher grade. It's not the medical grade where you need a fit test, but it is a higher grade. We did receive a good supply from the DOE. So we have those upon demand. And some folks are going to be a little more concerned because others will not be masking. They're going to want a better fitting mask. So we have those. Students, for parents who choose to have their children wear masks at school, the parents need to communicate the request to the teacher. Just like a parent requesting, I want my child to wear ski pants at recess, or I want my child to have a bag lunch instead of a school lunch. Just communication with the teacher about what your desire is. The students will receive reminders by school personnel to the extent possible. Not everyone is going to be in the know of who is supposed to have a mask and who is not. So we'll do the best that we can, but I think it's important to say that students who do not comply with parent requests will be referred back to the parent. The school is not going to be disciplining children who their parent wants them to wear a mask. I think that's a child and a parent issue. It's not a school issue. And the school cannot get into trying to police optional masking or universal masking. I think that would be unfair to the school personnel. We're going to have some education in the upcoming days around the power of choice. Some people will be wearing masks, some people won't, and we will not be teasing, we will not be bullying, we will not be harassing those who choose one way or the other. We're not going to start this mask versus unmasked in school type debate. We're just going to try to highlight the core values around this. We're going to respect everyone's choice, responsible of the family's preference. We'll be honest that when we test positive and we have to wear a mask for a period of time, that we're going to do that. And we're going to try to remember that to engage and invest in our learning, not on what's on our face or not on our face. On February 25, the announcement from the US CDC did remove the mandate to have masking on public transportation. So we are recommending that whatever we do in schools, which the recommendation right now is optional masking, we do optional masking on the buses as well. So it's not different on the bus than it is in schools. Other relaxing measures that we'd like you to consider that still keep us in line with the CDC recommendations, but it's steps that we took above and beyond that we think it's time to scale back. Those temperature scanning units, when we walk in the morning, the ones that detect coffee in your hand, we'd like to put those away, put them in the nurse's office for the purpose of detecting fever, for COVID or whatever reasons in the nursing office, but not having every student and staff scan when they come in, unless we go back to an outbreak status. If we go back to an outbreak status, we would recommend to bring those back out and monitor it that way. Water fountains, we have converted almost all of our water fountains to bottle filling stations, but we have put a cap on the actual fountain piece. It's safe now to remove those caps. If somebody wants a quick sip versus filling up a bottle, they'll have the option. Quick sip, but we even have cup dispensers, so we can go right to the cup to we're still gonna recommend you use the bottle filling stations. It's got an extra filter in it, so it's probably better water, but we're gonna remove those red caps. School lunches, we're going to try to do as much diagonal seating because 3-foot distancing is still a recommendation from the US CDC as we speak. So that distancing thing is still in place, but we can create 3 feet through diagonal seating. That original one directional seating, never facing anyone. We need to get away from that, and we've already done a lot of that in our schools. So it's just more of what we've already been doing. And then providing, some area of seating. If somebody has come out of COVID isolation, we do have to take into account that when they are unmasked, they need a little more distance. So we're going to account for that as well. School visitors, we'd like to open our doors again to visitors to the extent that we can. So volunteers, visitors in our schools and our classrooms, we'd like to, welcome people back again. That's going to be difficult in the cafeteria. So I do know that lunch is a wonderful time to come visit kiddos. It's hard to keep those 3-foot distancing when we have additional adults. So we'll be honest, as schools, when parents are asking to come visit or request to come volunteer, we'll just let you know if lunch is a possibility or not. But we would like to welcome our visitors back. We'd like to have regular presentations and trips, so welcoming folks into our school to present as we have in the past, allowing our students to go on trips as they have in the past. We'd like to rent our buildings out again to outside groups and have those outside groups in our schools. We'd like to allow our staff to enter from the entrances that they had before COVID-19. Now they're entering only where there's a scanning unit. We'd like them to park where they used to park and enter the building from where they used to enter, just for a little added flexibility. There are some things that have not changed that are still part of guidance. The guidance for isolation and quarantine still exists. So we have to adhere to that as it appears in the SOP. The last SOP in Maine is the February 16 version. We think one's going to come out next week, which may change some things, but for right now, we're following that isolation and quarantine recommendation, which is a 5-day isolation quarantine period. Return to school after 5 days if your symptoms are gone. With that being said, there is the masking mandate when you return from an isolation or a quarantine. So individuals who come back from a COVID infection or from a close contact, the close contact's a little bit different. It's only for unvaccinated folks, but you've got to mask for 5 days. So that's going to be a challenge for us. It's going to be a challenge for us to know who those folks are, but we're going to try to do it to the best that we can, keeping a running Google Doc with dates of return and making sure we're going to ask the staff and students to just try to be honest about that as best they can, so that we're trying to limit the spread of potential virus. Contact tracing is a relaxed measure. In other words, it's to the extent possible is the language they have in the SOP. Our nurses are very honest that it's very difficult these days because we're not getting the full picture a lot of times. So we're going to focus on family dynamics. If we have a family with siblings in the school, we're going to try to just do our contact tracing within the family unit as much as we can. Physical distancing, I mentioned before, it's still 3 feet to the extent possible, especially if you're unmasked for more than 15 minutes. Outdoors is still wide open, so there are no layered strategies for outdoors. Outdoors is like it always was before COVID, so that's good. We'll try to promote outdoor classrooms as soon as it's not below zero, and we can try to do that. So maybe that last week of school in June, that will happen. Sports, we're still going to defer to the MPA to give the guidance that they believe is right. We're done the indoor sports this winter, so we're moving to outdoor sports this spring. So it should be relatively painless there because softball, tennis, baseball are outdoor sport, and track are outdoor sports. We're still going to ask sick people to go home when they're sick. That's not a COVID thing. That's forever and ever. Since schools have been schools, we ask sick people to go home or stay home. And we're still promoting pool testing. Pool testing lost its effectiveness when there was so much virus because it seemed like everybody was testing positive. Every pool was a positive pool. Now it's back to minimal positivity. So I think we had one positive pool here at CHS yesterday. I think I know my pool was the one. So so it's back to having an effectiveness. Plus, it also keeps unvaccinated folks out of a required quarantine if they're in pool testing. So if you're unvaccinated, you're a close contact, and you're in pool testing, you can stay in school. And then a further recommendation from our school nurses. It is supported by the SOP, but in the SOP it does say recommended, and we all know that recommended is not mandated. Our nurses would like to promote a negative test to return from your isolation. So after your 5-day isolation, you want to come back on day 6, which you can. All we're asking is for a negative test. We'll do one right here. So it's not like we're sending you out to do it. We'll accept the Walgreens, we'll accept the St. John Valley RX, the Northern Maine Medical, we'll accept those, but we can do them right here as well. And that's just peace of mind that you are ready to return and you're not going to spread the virus. Although the recommendations in this transition plan do not put us back to normal all the way, they put us in a wonderful step in the right direction. So we hope the board can consider our recommendations as a total package as I presented in this transition plan. Question?
Yes.
Leroy.
So I'm going to start from the back since you're already there.
Yep.
On the return from isolation quarantine testing, I don't see any protocol here for if somebody actually has tested positive, what are we doing? Because obviously, I mean, they can't come back to school with a negative test if they're probably not going to test negative for 90 days, I believe, that you can still test positive. So what implementation is there for somebody that tests positive, stays home? I mean, what if they need to come back?
So the antigen test is the test that we're recommending to come back, and that's because the antigen test does detect it's only an effective test when you have symptoms, and you actively have the virus. In theory, in fact, it tests more negative than it does positive, so it's highly likely that we're gonna get those negative results. But because the CDC guidance says that you can return on day 6 to 10 if no symptoms exist, you're left to the individual being honest or not. We just like the peace of mind of having that test coming back.
And then under the optional masking, is there a specific reason why we have to have an automatic trigger when it comes to the 15% of the school? Is that not something that we could call a meeting to? Should we have that rather than having an automatic trigger?
We could. My fear is that we're going to be prompted to have meetings regularly, often, to just look at data that's going to be exactly this, right? So I'll sit before you. I'll say, okay, we're above 15%, and then we'll all go, okay, so what do we do with this 15% or 20%, whatever we are? I would rather we set that limit. Outbreak status was defined for a reason. And the school nurses, in consulting with the school nurses, we felt like that was a good natural trigger to just say, okay, let's mask up for a period of 5 days. We'll see if the virus goes through the school and then return. So that was the only reason. It was to have something as a measure to say, this is when we go back to optional, to universal masking. Because school data is always more accurate than a county designation color or a US CDC map that looks at, things that are probably 2 weeks old. We felt like real-time school data is really more valuable. Okay.
So under the net, which would be the next page.
Okay.
Right there. Okay, so I'm actually okay with the staffing, the masks available. My question is that under the next section where it says students, shouldn't this be more of a parent policy, like you said?
Yeah.
I mean, is that something that we actually need our educators, our teachers to, interact with them on the students on that? I mean,
What I would propose is, once you all adopt this, if you adopt this, we would send out education to the parents on what optional masking means and what the parent's responsibility for that is versus what the school's responsibility is. I think parents need to know that we are not going to be the mask police for them. It's just not fair for our staff.
because a lot of the concerns that I've heard from our teachers is that they feel that they've moved to be mask police.
Yeah.
Rather than, and I mean, that takes away from the time that they have to, teach what they're supposed to be.
The only thing that our staff will concern ourselves with moving forward, if you adopt this, is do we have students teasing, bullying each other because of masking? And I think that's our responsibility to watch out for, but we will no longer say, hey, you're supposed to have a mask. Hey, you're not supposed to. It's too much for our staff to try to control.
And then going along with the core values and the option in there you go. Isn't that something that could be done in that same reference, in that same information packet that you send home?
Absolutely.
Or maybe during a periodically through a morning announcement?
Absolutely.
Or something,
Yep.
rather than delaying the inevitable here?
Yeah, no, whatever we decide to do here, all I wanted to press upon the board is that we would like to make sure that we are communicating that we're going to be respectful of one another no matter what people choose. How we do that is really going to be up to the schools, how they disseminate that to their students.
Sure, that was the last question I had.
Anybody else have any questions?
Ben, I think you did a really good job putting that together. It's actually a lot more lenient than what I thought you were probably gonna come up with. The only thing I really don't like is like Leroy said about the automatic trigger. They haven't worked well for us in the past on anything we've used them for. That would be my only, my only consideration would be to maybe change that language to something that triggers a board meeting and not automatic universal masking. You guys think?
I think all along we've had some sort of trigger and yes, sometimes they're not. I mean, last year it was, remember we had the, how many, depending on how many cases, and there was times where it was like, there are 6 active cases today, which would have triggered it, but tomorrow there's gonna be 3. So I feel, and so the decision was made to like, well, we're not gonna go remote because of, for one day kind of thing. I think that makes sense. I mean, and we're not talking about going remote, we're talking about masking for 5 days until we can get over the hump to try to minimize that need for it getting to the point where we have to do things that are more extreme. I agree. I think this is
I
good.
would be comfortable with saying simply, unless the main CDC changes their guidance, then we just stick with whatever the main CDC says. And not having a school trigger. I defer to the board. I'm just going based on what is comfortable with our staff that review this. And it was based on some of the recommendations that were made in some other county schools, and that's kind of what we
Yeah,
went.
I think that having that trigger is a good thing. And then if we need to, if it doesn't make sense, I mean, then we can meet and be like, okay, well, this trigger doesn't make sense or something. But when you're talking about the main CDC, it's the US CDC that puts out that new guidance with the new colors now, the low, medium, and high.
Yep.
Which we just went back to medium last night. It was only high that, it was kind of confusing reading that piece as far as it was, they recommended masking, but
So when we met with Dr. Shaw, what's the date? So we met with Dr. Shaw Wednesday. Most of Maine was in red still. And the question did come up is how can Maine be recommending optional masking? Optional masking when we're all in red and the US CDC says red means you should be masking. And he was pretty good about explaining how that is delayed data on the US CDC map and health-based centers and how they figured that out. Now it's based on hospital bed capacity. And so it all, to my understanding, almost looks like you're a couple weeks out of what it really is, which is probably why we changed to yellow last night. So I think the Maine CDC has a good bead on what's happening in Maine. They're using wastewater testing, they're using hospital bed capacity, they're using test positivity rates. I really think that the Maine CDC should be our guide, regardless of what the color happens on a US CDC map. I think Maine will respond correctly based on that.
and they were the ones, well, them and the DOE are the ones that came up with the 15% for an outbreak.
That's a CDC, the Maine CDC. Yeah, and then that's always been their benchmark for outbreak before COVID.
Yeah.
So if we had 50% of our students out for measles, then it would be an outbreak. So that they went to that same measure.
I guess I don't have a preference or a strong preference one way or the other, but would it not make sense maybe instead of having the trigger at 15% to, let's say at 10%, have the conversation like our numbers are going up, can we skip? That way we're not waiting till we're at 15 and then we're scrambling to make a meeting time. We all work, it's hard. So I just think maybe at 10% we have the conversation, hey, our numbers are looking like they're going up. Can we look to schedule a meeting to discuss this further? I guess that would be my suggestion.
Well,
I don't see a big deal with having the trigger because we've never followed them before. We've always deviated grossly from them. When we approach a trigger, whether it be for this or for something else, if it looks like it's going to come back down again, the administration's always kind of been like, well, we're not going to bother. And that's fine. I really don't care about that. But I think But I think having a meeting every time we do this is a giant waste of our time. But I gotta work.
I think it's splitting hairs. From what I understand, if the 15% trigger takes effect, we're doing it, so we're considered universal masking school, which is gonna allow the close contact students to stay in school, especially if there's a full testing program that are not vaccinated. So I'm okay with 15%. I think we need to be real careful about being real nitpicky about some of these things. And we need to let administration do their job and bring us their recommendations. I'm not looking to drag this out any longer than any of these folks. I just want to have this behind us. So I'm okay with this transition plan that's been presented. So you looking for a motion?
Sorry, Izzy didn't have any.
I'm sorry, I apologize.
That's fine. I just find that sometimes the triggers, like you said, like one day you can have 6 and the next day you'll have 3, like cases. I guess with that, it's just kind of, and since we're kind of a small school, like that 15% isn't necessarily a lot of cases. So like Sarah was saying, whenever you have one day and it's 6, the next day it's 3, that's the only problem that I have with those like automatic triggers. Like,
15% of our school population is 51.
Right, right.
Oh,
So,
okay.
I mean, it's pretty high. We didn't come close to that this year. I mean, we were up 40 at the worst. So I mean, moving forward.
So this school never got an outbreak status this year. It never happened. Fort Kent Elementary did once. So an outbreak status is rare, and it was eminent when we saw a huge spike. Honestly, I think that if a new variant of the virus comes out that would put us in the potential of having an outbreak status, I think the main CDC would change their recommendations anyway. I don't think we're gonna see outbreak status with the levels as they are in Maine saying, okay, we'll move to off. I'm being very honest. That's it.
I would actually, I mean, given that light, I would actually be okay with the 15%. I would like to see it change to be effective today rather than the 9th. I don't really see a purpose and dragging out. Once again, like I said, what's gonna happen, might as well put it in effect today and be done with it. I'm sure that we would have a lot of happy people.
I completely understand what you're getting at. The color coding changed today. Everybody's ready to just take them and just fling them. The only problem, and it's not really a problem, it's just a matter of policy, simple policy. And if everybody here on the board votes unanimously to change the motion as laid out in the agenda, we can change that date. But right now, the next motion under new business, which we haven't discussed yet, that motion would probably have to fail, and then we'd have to introduce a new motion.
That's a recommended motion piece.
Right.
Are we ready for a motion?
Within the agenda.
Can I just, before you guys start, I totally agree as well. In fact, I would say yesterday instead of today, if I could, but I do want to just be, I want to be mindful of the families that need to wrap their minds around this and how they're going to educate their own children about, we want you to be wearing your mask. So I would at least say, wait till Monday. If you're gonna make any changes, wait till Monday. That's the only thing I would recommend, just so that we're not here at school today and the kids are already on buses and they haven't had a chance to talk with mom and dad. And, you know, some kids are ripping their masks off and some are not. I just would rather families have at least a day to talk about it. That's the only thing I'm concerned with. If I'm being honest.
I agree with that. I think doing it today, I mean, there's kids probably almost getting to buildings, so I feel like that's not really fair to families.
Yeah, I dropped my daughter off before I came here.
So
I'm comfortable with.
what I'm gathering is from what you're saying is there'll probably be mass, well, I don't say mass confusion, but some of the little kids who've been wearing their masks and they understand where they're wearing their masks. If they just come to school, all of a sudden the teachers, the staff, everybody to explain to them what's going on today. And let's give the parents a chance to do that with their children and then come in Monday if the board so decides.
Been dealing with masks for 2 years. The majority of kids, once they leave this building, do not wear a mask. They're not masked at the ski tow, they don't have masks anywhere else. Those kids that the parents want them masked are very clear. The parents want a mask because they're wearing them at the Swan Buck, they're wearing them at Pat's Pizza, they're wearing them everywhere else. So I think to delay any more than today is ridiculous. School districts all across the state are going effective immediately. March 9th, March 7th, it's all throwing darts. We've dealt with this. This isn't something that happened overnight.
I don't think it's fair to make a policy change when school is already, when in the middle of a day. I think if this meeting had been last night and at least had the parents, kids have left the homes, I don't think that's fair. I wouldn't agree with that.
I don't think it's fair. We had to fight all week in an emergency meeting, so we're ready for a motion.
Okay, so first of all, we're still under the superintendent item, COVID-19 transition plan. And we have a motion to accept the COVID-19 transition plan as presented.
Well, I'd just like to make a note, like why the new business is a motion to adopt the main CDC's recommendations and the MSAD27 transition plan. Are we moving, which one are we moving for?
Well,
This is
So under superintendent, usually I just present things, you guys don't take any motion.
Yeah, we don't need a motion.
So I think what we try to do is move to new business.
very good.
Oh, I
So
see what
under
you
new
mean, sorry.
business. Under new business.
Yeah.
Do we have a motion to adopt the main CDC's recommendation and the MSAD27 transition plan as presented effective March 9, 2022? Do we have a motion? Seeing none. Motion fails. Would somebody like to make another motion?
I would make a motion to adopt the main CDC recommendations and the MSAD27 transition plan as presented effective immediately.
Do we have a second?
I'll second.
Leroy seconds it. Any further or any discussion regarding immediate implementation of the optional masking policy?
Two issues. Well, I'm not even gonna talk about the immediate part. That doesn't, like, I'm with Sarah on that. I think it's foolish to do something this quickly. Because it's literally one school day. But I want to point out that when we received the transition plan yesterday, one of my concerns here is the transition plan, the MSAD27 transition plan. Maine CDC hasn't renewed its plan officially yet. There's some stuff that came out of the governor, but there's no new plan. How are we going to handle when Maine CDC's plan contradicts our transition plan?
Well,
Because they're two distinct plans.
I think Ben can respond to that.
So the only thing that the main CDC is holding off on is data coming out of the February break to support the recommendation they made Wednesday. So I think given the fact that all counties have moved to yellow effective yesterday, proves that those numbers are declining. We see it in our own schools. So the main CDC is not going to come out with other revisions of any plan. They'll have a new SOP that might have more restrictions, but we've never come to the board level for you to approve an SOP. That's something we just have to follow. So I think the only thing the main CDC is waiting on was that data to support the announcement they made on Wednesday. And that's what we're waiting for.
Okay, well, I guess it just seems like it would have made more sense to either follow the Maine CDC's recommendations or the MSAD27 transition plan, because we're opening the door for there to be two contradictory parallel plans. Because we have two, we're adopting two plans by one motion.
Let me, oh, I see, it does include the transition plan. work.
So
So if we were to remove the transition plan, we will allow administration the flexibility to adjust that as needed, because it might be a moving target.
So the only thing in this transition plan, and the reason that we've called it that is because we are telling you guys that we're recommending relaxed measures. Temperature scanning units, water fountains, these are not things that the main CDC made us do. These are just things that we'd like to roll back on because I'm tired of seeing kids waiting at the door to scan their forehead when I don't think we got a single fever in 2 years on those scanners. So these are the things that I'm just trying to show you in this plan. So we don't have to call it a plan, we can just call it whatever, but I'm fine with it. I'm just letting you guys know this is what we'd like to do.
Okay, so it's really just, it's all about the wording, right? Because the original motion has transition plan as presented. If we take as presented out of a future motion, that gives our administrative team the ability
To
to adapt to whatever's thrown at them.
I agree.
And that can change on a daily or weekly basis.
Remove the as.
And we don't want to be having meetings every other day.
My concern is if we end up in a situation, because these are two distinct recommendations, the transition plan is a recommendation. We don't want to put ourselves in a position where we're having to deal with the fact if they diverge, which they could. Things change so often. I mean, we've had to deal with just crazy stuff for the past 2 years, and I don't want us to be in a position where we have two conflicting plans.
So can I amend my motion?
Actually, the first motion died. Oh, it didn't, it didn't vote yet. Why don't,
I have a,
you had a second on it, so we,
can I make a comment for you? Because if we do that, if we just go to the main CDC's recommendation, their recommendation to move to optional masking is March 9th. So if we just follow their recommendation, right, we are masking until March 9th.
That's the recommendation.
That's the recommendation.
And I'm okay with removing any motion to accept the transition plan. It's an administrative plan, so administratively, we're just gonna put that plan in action because it's not against any guidance that we've received from the Maine or US CDC. So I'm okay with that.
Honestly, Ben, that's the best part of the whole motion is the transition plan. It truly is. So can I amend my motion?
vote for it.
And make the motion to adopt the current main CDC recommendations in the MSAD27 transition plan effective immediately.
There's a second for that one. Second. Any further discussion?
It inherently is broken because the CDC's recommendation is March 9th.
Right.
So we are in adopting it, we are breaking it.
So would it make sense to remove motion to adopt the MSV transition plan as presented?
Well, no, it's the CDC part. CDC's recommendation is March 9th, so we can't say we're gonna follow the CDC's guidelines
Right,
and then in the same motion violate the CDC's guidelines.
but if you remove the main CDC recommendation from that and just go with the MSV number 27 transition plan,
Which is based on the main CDC.
but, right,
Voted.
What was added in here?
And Ms. Lozier?
Oh.
yeah, no.
How, I don't know how you get out of the.
Okay, how about if you motion to accept the Maine CDC's March 9 recommendations effective immediately?
There we go.
Well, I feel comfortable with it Monday, but
Well, or Monday.
Well, we have a motion on the floor. Let's take that motion. We're gonna start over with a clean slate. All those in favor of Gary's motion, and Leroy's second. Show of hands, all four. 4-4. Any opposed?
I think we should wait till Monday.
Okay. Motion passes. Effective me.
I still don't understand how that, if the CDC currently says that masking moves to optional on March 9. I don't know how you take off masks today. If we said that we're gonna do this, starting right now, that recommendation isn't effective until Wednesday. So we're still masking until
So I'll
Wednesday.
make another motion
It-
to do the exception of their implementation date.
It's already passed.
The motion's already through.
So why are we continuing to talk
The
about?
motion was.
Well, because I
Well, we
think
can
Gary,
do-
because it's illegal, we created we passed a motion that on its face is violates itself.
Right.
We violate, when I suppose, I mean, I guess on some level, nobody cares anymore. But I think it's problematic when we're, I mean, I'm just gonna say, we're having emergency meetings to pass motions that don't even logically follow themselves.
All right, so we need to take a step back. Gary, would you like to make a motion to rescind the previous motion that's passed? Once we get that cleared, then we can enter into a proper motion. Just a motion to rescind.
But
The following students,
Effective
please
immediately.
report to the senior room. Emerson Bois, Lauren Braun F., Sadie Carn, Vera Kelly, Sarah Labby, Kaylee Neto, Connor Pelletier, Ethan Raymond, Nathan Townsend, Connor Vincent, Nathan Susan, and Logan Wood.
So I have a question. Based on the motion that just passed to follow Maine CDC's recommendations effective immediately, does that mean masks come off today or not? Because those, like, I see what you're saying, those are two different things, because CDC's recommendations, we're saying we're gonna follow them starting immediately, and the recommendation is to unmask on Wednesday.
I would make a motion to rescind my motion.
a second.
Very good. All in favor?
I don't even know what to do.
So basically what we're doing, we're.
But if I
backing
didn't,
off our
if I
previous-
didn't vote on that, do I, on the original
Listen,
one?
we passed
I can still
Gary's,
vote on it.
we passed Gary's original motion. We decided to pass.
Yeah, I didn't know if I could vote on a rescinded motion that I didn't vote for in the first place. That was my question.
Doesn't matter, we're making it all up.
So I'm gonna make a motion to.
All in favor of rescinding that motion?
I'm against.
All
So-
yours.
I'm going to make a motion to adopt the Maine CDC recommendations in the MSAD 27 transition plan with the exclusion of the implementation date of March 9th. Make it effective immediately.
Seconded by Larry, Leroy, sorry, not Larry. Not yet. Any further discussion?
Just so you all know, we're not going to be making any huge announcement in schools. We'll let parents communicate with their children. So that's just for peace of mind thing, so that, you know, I'm less concerned about this building. I'm more concerned about the elementary building. So there's not gonna be like a big unmasking ceremony.
Oh, there will be somewhere.
Very good. Any further discussion? All in favor? Any opposed?
I still think we have the problem, but I'm just gonna leave it at that.
Understood. Motion carries.
Is there a need to have a meeting next Monday? Or can we delay for a couple of weeks to see how this all goes? And then I'm proposing Tuesday, March 15th or Wednesday, March 16th.
The date's good.
I don't think I'm around, but that's okay.
Tuesday. would be
Tuesday.
better than Wednesday for me.
Okay, so can we, I'll send a notice Tuesday,
March 16th.
March 16th.
All right, motion to adjourn. Leroy, seconded. Abigail, all in favor? Very good.
Thank you.
This is a happy kid.